I'm Vicki Libiakis, and welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. And with us today, we have Dr. Elizabeth Lee. We're talking about neck lift surgery and anything else you want to talk about. We're going to be taking your calls with questions. The phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, you're going to certainly want to consult your own physician as well. Although Dr. Lee is one of the top plastic surgeons in the area and a really fun person to have on the show. Welcome back to the show, Dr. Lee.
Thanks very much.
We're talking specifically neck lifts,
right?
Which, you know, in the whole scheme of things, when people say I need a change, they usually go, I need a facelift, and then they forget about the neck.
Right.
And that used to be the telltale sign that someone's true age, right?
Right, right. So we, traditionally we were taught that you could not improve the appearance of the aging neck unless you did an entire facelift. And that's actually not the case. So with some newer techniques, a newer understanding about the way the face ages, we're able to improve the neck, which actually is one of the first things to show signs of age in women.
Is that a different type of skin? I mean, I noticed that there's, there's some skin can take more sun than other parts.
Right.
Or is that just a myth?
Well, it's always a good idea to protect yourself from the sun. But what happens, I think, that starts making the neck look older is that the fat from the face settles down, and so the fat from the cheeks ends up along the jawline, and the muscles in the neck directly underneath the skin, which when we're young make a nice tight sling to support the skin, start to separate, and so you get bands in the neck. You can get sagging of fat that should be held up and give a nice smooth contour.
Well, the skin itself, after it's maybe exposed to too much sun or age, it starts looking crepey.
Some people get very, very crepey. And so it's also important to know that you should be taking care of your skin, because we can do perfect surgery, but if your skin is really sun damaged, then you're putting that sun damage back on top of the surgical procedure.
And I know you're going to give that lecture that you give everybody, which is
sun protection.
Sun protection.
Yes.
Even on an overcast day.
Especially on an overcast day, because you don't feel the sun, you don't feel the heat when it's overcast, but the UV radiation is getting through those clouds.
Well, no matter, even if you're in your 20s or your teens, they say that the most damage occurs in your younger years, and you start seeing
when you don't know what's coming down the road. So you start to regret in your 40s what you did in your teens. So it's always good to try to slather sunscreen on your kids now. Okay, now I'm going to play devil's advocate here for a moment. What's wrong with just walking around with a turtleneck sweater? Well, and if you've read Nora Ephron's book, not to plug it, I have no, but it's fine. It's really okay to feel comfortable with signs that you've got some experience. That's all right, but not everybody's comfortable with it. So if you're not, and if it's something that is absorbing your thoughts as you try to get ready, or makes you a little self-conscious when you need to do a presentation at work or talk to your younger colleagues, then it is something to consider.
Now, and again, I want to play devil's advocate here, because there are some people who fixate on a particular part of their body, and they see something that the rest of the world doesn't see.
Well, there's a fine line between seeing something that's really not there and seeing something or feeling something about yourself that other people might not notice. Okay, so everybody focuses on something. There's something that they like about themselves or something that they don't like about themselves, and it's human nature to sort of focus on what you don't like and look at all the good ones in other people, so that you're always being drawn towards, if your neck is bothering you, a nice, slim, tight neck.
Well, I know you've brought some pictures to show before and afters, and also we're going to discuss whether these people had to undergo surgery, or whether there are other techniques.
There are techniques, but these are all surgical results that we're showing today. And I just want to make it clear that I've cropped the pictures very, very tight, because in my neck of the woods, anonymity. Oh yeah, that's true. Okay. Anonymity is really important to patients. So I'm asking the audience to be aware that I'm not showing the whole faces for a reason. Okay.
We've got to take a quick break. For more information about Dr. Lee, you can call her directly, 510-704-2170, or check her out on the web at artfulsurgery.com. We'll be taking your phone calls and continue our talk about neck lift surgery when we come back on Body Beautiful.